Hey everyone, welcome back to Buck Breakdown, where we tackle the economic policies that actually impact your wallet. Today we're talking about something that directly affects over 75 million Americans: the newly announced 2026 Social Security Cost of Living Adjustment. And before you click away thinking this only matters if you're retired, hold on. This story touches inflation, healthcare costs, government spending, and whether the system we've all been paying into will even be there when we need it. The headline number is 2.8%, which translates to about $56 more per month for the average retiree. Now, that might sound like good news on the surface, but here's the twist. For many people, that increase will vanish before it ever hits their bank account. We're going to break down why that happens, what it means for the future, and what you need to know whether you're collecting benefits now or planning to decades from now. Let's dive in. The basics. All right, so first things first. What exactly is a cost of living adjustment? Think of it like this. Social Security isn't supposed to be a fixed number that stays the same forever. It's designed to adjust every year based on inflation, so your purchasing power doesn't just evaporate over time. You paid into this system your whole working life, and the idea is that when you retire, those benefits should keep pace with the real cost of living. The way the government calculates this adjustment is by using something called the Consumer Price Index for urban wage earners and clerical workers, mercifully shortened to CPI-W. Basically, between July and September each year, they track how much prices change for everyday goods and services: groceries, gas, housing, utilities, all that stuff. Then they compare that to the same period from the previous year. Whatever percentage increase they find becomes next year's COLA. This year, that number came in at 2.8%. So starting in January 2026, if you're receiving Social Security retirement benefits, you'll see that bump reflected in your monthly check. Now let's put that in context. Last year's adjustment was 2.5%. And if you remember back to 2023, we had a massive 8.7% increase because inflation was absolutely raging. Grocery prices were skyrocketing, gas was through the roof, and rent was climbing faster than most people's paychecks could keep up with. So, compared to that chaos, a 2.8% increase actually signals something important. Inflation is cooling down. The economy is stabilizing. That's genuinely good news for the country as a whole. But here's the problem. Just because inflation is slowing doesn't mean prices are going back down. They're still high. They're just not rising as fast. And that's where the frustration comes in. The real impact. Let's talk real numbers. After this increase, the average monthly Social Security retirement benefit will be about $2,064. That's up from roughly $2,008. So yeah, $56 more per month. But here's the kicker, and this is what drives people crazy. Healthcare costs are about to eat up a huge chunk of that increase. Medicare Part B premiums, which cover things like doctor visits and outpatient care, are expected to jump by about $21.50 per month. That's going from $185 to around $206.50. Do the math, and nearly 40% of that COLA increase just disappeared to cover healthcare. I've seen interviews with retirees who sum it up pretty bluntly. One couple said their combined increase would be around $168 a month, and after Medicare takes its cut, they're left with barely enough to cover one decent dinner out. That's not exaggeration. That's the reality for millions of people. And here's what really stings. According to recent polling, about 72% of people over 50 say they would need at least a 5% increase just to keep up with their actual rising costs. Only about 1 in 4 feel like a 3% bump is adequate, so there's this massive gap between what the government thinks is fair and what people are actually experiencing. And that gap isn't just frustrating, it's financially painful. The formula problem. Now, this brings us to a deeper issue that doesn't get talked about nearly enough. The formula itself might be broken. Remember that CPI-W index I mentioned? Here's the thing. It's based on spending patterns of younger, working-age adults. It tracks what people in their 30s, 40s, and 50s are spending money on. But retirees don't spend money the same way younger workers do. For starters, healthcare costs make up a much bigger portion of a retiree's budget. Same with housing expenses, especially for people on fixed incomes. But those categories get less weight in the CPI-W calculation because working-age people don't spend as much of their income on them. There's actually a different index called the CPI-E, the Consumer Price Index for the elderly, that specifically tracks spending patterns for people 62 and older. And guess what? It consistently runs higher than the CPI-W because it gives more weight to things like medical care and prescription drugs. If the government switched to using the CPI-E for calculating Social Security adjustments, retirees would likely see slightly larger increases each year, but that would require Congress to pass a law making that change. And given how slow Washington moves on anything related to entitlement spending, I wouldn't hold my breath. So for now, we're stuck with a system that might be underestimating what retirees actually need to maintain their standard of living. Regional disparities. Here's another angle that rarely gets attention. A one-size-fits-all percentage increase doesn't account for where people actually live. Think about it. A 2.8% raise means something completely different if you're living in New York City versus living in rural Alabama. According to cost of living studies, an older adult in New York might need over $30,000 a year just to cover basic necessities, housing, food, utilities, healthcare. Meanwhile, someone in Birmingham might get by on around $21,000. That's nearly a 50% difference in actual living costs, but both people get the same 2.8% COLA adjustment. So for someone in an expensive urban area, that increase barely registers. For someone in a lower-cost region, it might offer a bit more breathing room. The system treats everyone equally on paper, but that doesn't mean it affects everyone equally in practice. And that's a structural challenge that doesn't have an easy fix. Payroll tax changes. Now, if you're still in the workforce, here's something that'll hit your paycheck starting next year. The Social Security payroll tax cap is going up. Currently, you only pay Social Security taxes on income up to $176,100. In 2026, that cap rises to $184,500. So if you're earning above that threshold, you'll see a slightly bigger chunk of your paycheck going towards Social Security taxes. Why does this matter? Well, it helps keep the program funded. More money coming in means the trust fund doesn't deplete as quickly. But it also means higher earners are shouldering more of the burden to keep the system afloat. And that brings us to the elephant in the room: the long-term crisis. Let's talk about the future, because this is where things get genuinely concerning. The Social Security trust funds are projected to be depleted by the mid-2030s if Congress doesn't make some serious changes. And when I say depleted, I don't mean the program shuts down entirely. What I mean is that Social Security will only be able to pay out what it's taking in through payroll taxes, which would result in automatic benefit cuts of around 20%. Think about that. If you're planning to retire in 15 or 20 years, there's a real possibility you could see your expected benefits slashed by a fifth unless lawmakers act. And so far, not a lot of action. There have been proposals floated. Raising payroll taxes further means testing benefits so wealthier retirees get less, gradually increasing the retirement age. But none of these ideas have gained enough political traction to actually pass. This is the ticking time bomb nobody in Washington wants to deal with, because every solution involves either raising taxes or cutting benefits, and both are political poison. But the clock is running, and ignoring it doesn't make it go away. Why this matters beyond retirees. Here's the part a lot of younger people miss. Social Security isn't just some program for old folks. It's the backbone of retirement security in America, and if it fails, that affects everyone. Traditional pensions are basically extinct at this point. Most companies don't offer them anymore. And study after study shows that Americans aren't saving nearly enough for retirement. A recent Vanguard analysis found that only about 42% of Americans are on track to maintain their standard of living once they stop working. For the other 58%, Social Security is often the only thing standing between them and poverty in old age. So when we talk about COLA, increases and trust fund solvency, we're not just talking about today's retirees. We're talking about whether the safety net will still exist when your parents need it, when you need it, and when your kids eventually need it. That's why these annual adjustments, even modest ones, carry so much weight. They're not just about economics. They're about whether we're keeping the promise we made to generations of workers who paid into the system their whole lives. Practical steps. All right, so what can you actually do with this information? If you're currently receiving Social Security, first thing, check your actual benefit amount. You can log into your My Social Security account online and see exactly what your new monthly payment will be starting in January. Don't just assume it's $56 more. Look at your specific situation, especially your Medicare deductions. If you're still working, even part-time, consider that every extra year you contribute to Social Security can increase your eventual benefit. Delaying retirement even by a year or two can make a meaningful difference in what you'll receive down the line. For those of you helping aging parents or grandparents, this is a good time to sit down and go over their finances. Make sure they understand how much they're actually getting after Medicare premiums. Help them budget realistically for rising healthcare costs, because those tend to climb faster than any COLA adjustment will cover. And if you're younger and still decades away from retirement, the biggest thing you can do is not rely solely on Social Security. Max out your 401k contributions if you can. Build an emergency fund. Invest in a Roth IRA. Diversify your retirement strategy so you're not putting all your eggs in one basket that might have cracks in it by the time you need it. The bigger picture. So where does all this leave us? The 2026 COLA adjustment of 2.8% is simultaneously good news and frustrating news. It's good because it shows inflation is cooling. It's frustrating because for many retirees, it won't be nearly enough to keep up with their actual costs, especially health care. The Social Security system is doing what it was designed to do, adjusting for inflation annually. But the formula might not be capturing the full picture of what retirees are facing. The regional disparities mean some people feel relief while others barely notice a difference. And the long-term funding crisis means we can't just keep kicking the can down the road. Social Security Commissioner Frank Bessignano said something important when the COLA was announced. Social Security is a promise kept. And that's true. The system has been remarkably reliable for nearly 90 years, but keeping that promise in the future is going to require some tough decisions that nobody in Washington seems eager to make. What gives me hope, though, is that this isn't a partisan issue. People across the political spectrum care about Social Security. They might disagree on the solutions, but everyone understands it matters. So maybe, just maybe, when the pressure gets high enough, we'll see some real leadership emerge. Until then, we've got to stay informed, plan accordingly, and keep the conversation going. All right, Buck Breakdown crew. That's the full story on the 2026 Social Security Cost of Living Adjustment. It's a modest increase in a complicated system with some serious challenges ahead. Now I want to hear from you. Are you receiving Social Security benefits, and does this increase feel adequate? Are you worried about the program's long-term future? Or are you younger and thinking about what this means for your own retirement planning? Drop your thoughts in the comments. I genuinely read them and learn a lot from what you all share. If this breakdown was helpful, hit that like button and subscribe to the channel. We're covering the economic policies and political decisions that actually affect your life, and I don't want you to miss future episodes. Thanks for spending your time with Buck Breakdown today. Until next time, stay informed, stay engaged, And remember, understanding the system is the first step to navigating it successfully. See you in the next one.